I want you to make a fist right now and squeeze it as hard as you can. The fist you just made will tell you more about what is going on with your heart than even blood pressure does. In the next few minutes, I am going to show you 7 things about your hands that reveal what is happening deeper inside your cardiovascular system. What you need to know first is that between 45 and 50% of heart attacks are completely silent. They give absolutely no symptoms whatsoever before they happen. Even if you have high blood pressure and normal cholesterol, you can still have a heart attack. Even if you have no chest pain, you can still have a heart attack. Your hands may be warning you right now and you just do not know it yet. Welcome to Health Mile. If this is helpful, please hit the like button and subscribe to our channel. We bring you practical, science-backed health guides every single week. And tell us in the comments, which city are you watching this from today? Sign number 1, the grip test. A study published in The Lancet in 2015 found that for every 5 kilograms, that is 11 pounds of grip strength you lose over time, your risk of dying from a heart attack increases by 17%. And this was not just one study. It was replicated across several. Grip strength actually beats blood pressure at predicting who will die from heart disease. When was the last time your doctor tested your grip strength? Probably never, because they focus on blood pressure. If you have a grip strength tester, men should stay above 81 pounds or 37 kilograms, and women above 51 pounds or 24 kilograms. If you do not have a tester, use a simpler method. Do you tend to ask others to open jars for you? When you shake someone's hand, does it feel firm or a little weak? That tells you where you stand. Sign number 2. Ring finger that lifts off the table. Place your hand flat on a surface. Does your ring finger lift up? Does the skin in your palm feel ropey or tight when you try to press it flat? And this is not really a hand problem. It is a warning light. A review of over 32 studies found that people with this condition are 3 times more likely to have diabetes and almost 3 times more likely to have serious liver disease. A 23-year study of over 30,000 people backed this up. When blood sugar stays high for too long, the extra sugar sticks to proteins in your body and damages them. That same process is directly correlated with what is happening in your heart and arteries. If your ring finger does not lie completely flat, get your blood sugar checked. Sign number 3, clubbed nails. In a normal finger, there is a clear angle where the nail meets the skin. When you have nail clubbing, that angle shifts and bulges outward. The fingertip starts to look like the end of a drumstick. Research shows that 75% of clubbing cases come from the lungs, which can also be indirectly connected to the heart, and 10 to 15% come directly from heart conditions. If you have noticed this change in the last 6 months, get it checked without delay. Sign number 4, white or cloudy nails. The nail bed should normally have a healthy pink color. When the heart is not working properly, the nails can turn white or cloudy. A patient of mine, a 54-year-old construction worker named Robert, came in not for a heart problem but for a contracted finger. When I looked at his nails, they were clearly cloudy and white. His history showed a diet high in refined sugar and carbohydrates. His A1C was on the high side. He was pre-diabetic. Something did not sit right with me, so I referred him to a doctor. We worked together on his case. I handled his nutrition, sleep, and exercise while his doctor monitored his heart. His EKG and heart tests improved significantly. His finger contracture never changed. There was too much scar tissue by then. If I had only focused on his hand and ignored everything else, who knows what might have happened. Sign number 5. Yellow bumps on the tendons on the back of the hand. Extend your fingers and look at the back of your hand. You will see the tendons running from your fingers toward your wrist. If you notice small firm yellow bumps sitting on those cords, this may signal a cholesterol problem. Cholesterol can build up on tendons, particularly in people with a genetic tendency toward high cholesterol. A study of over 951 people linked these bumps to a 36.7% increase in the rate of heart attacks. And if you are a woman over 51, that risk jumps 17 times higher. If you see these bumps, do not settle for a basic cholesterol test. Ask for an advanced lipid profile that looks at particle size, because small dense particles are the real danger. Sign number 6. Fine tremors in both hands. Not a shaking, but a tiny fast quiver happening in both hands at the same time. About 75% of people with an overactive thyroid experience this. The thyroid tremor typically comes with hands that are also warm and slightly damp. If you notice tremors in both hands, get your thyroid checked. An overactive thyroid E hyperthyroidism can place serious strain on the heart. Sign number 7. Cold hands triggered by stress. Many people assume cold hands mean poor circulation, but that is not always the case. Cold hands are often connected to the autonomic nervous system, the fight-or-flight response, which directly affects circulation and heart function. If your hands are cold all the time, regardless of stress, it is likely not heart-related. But if stress is what triggers the cold hands, that is worth looking into more deeply. If any of these signs apply to you, here are the tests to ask your doctor about. Get your grip strength measured. Check your resting heart rate. You want it below 75 beats per minute. If it is sitting at 80, 90, or 100 at rest, get it evaluated. Get an A1C test, which gives an average of 3 months of blood sugar and reveals a great deal about cardiovascular risk. Ask for a fasting insulin test. You want this as low as possible because high fasting insulin strongly predicts inflammation in the arteries. Get a thyroid test to rule out hyperthyroidism. And consider a CAC test, the coronary artery calcium test, which is one of the best tools available for seeing exactly what is happening inside your arteries. Your hands are not just tools. They are a window into your heart. Pay attention to what they are telling you. If this video helped you, please hit the like button and subscribe to Health Mile so you never miss a video. See you in the next one.